Remember to wear red today. It's meant to show your support for Heart Health Month. National Wear Red Day honors survivors of heart disease and stroke and brings awareness to risk factors. Well, it's also a life-saving reminder for women to take care of themselves. This morning from Mercy Medical Center in Merced, we're talking with interventional cardiologist Dr. Garima Honda. Dr. Honda, thanks a lot for your time this morning. We appreciate it.
Thanks for having me.
What is the current state of women's heart health? I understand it's still the #1 killer for new moms. I mean, among other real big concerns for all women.
Yeah, so it remains the #1 cause of heart disease in women, or #1 killer.
Yeah.
And it's very important to really focus on that and spread awareness, because about 80% of these heart diseases are preventable just by lifestyle changes. So all the women out there, it's very important that you know what your risks are. Preventing it really is the key here.
So let's talk then about some of the signs first. How do we even know if we have some heart health issues?
Yeah, great question. A lot of women, so women present very differently with heart disease as opposed to men. Chest pain, chest discomfort is the main symptom that women would have, but women can just present with just nausea, just shortness of breath. I've had women just come in with neck pain and they were having attack. So subtle symptoms is how women present. So knowing those, and really, women just trust your gut instincts, because a lot of times women would come to me and they would tell me, hey, I know that I felt something wrong, but I just didn't want to seek any medical care, just because I thought it was indigestion or anxiety. So not ignoring those symptoms here is very, very important.
So, the thing also is about age. Sometimes we think, oh, that we don't even have to worry about it until we're, I don't know, 60 or 70. Do you agree with that?
No, absolutely not. It's a big, big misconception that heart disease is just a disease of old age. It's not. It starts decades before your symptoms start to manifest. So if you can prevent it early, you can really, really prevent the bad outcomes that you can have with heart disease.
I always had really, really low blood pressure my whole life. And then in my early 50s, I started getting anytime I'd see a doctor, they'd take your blood pressure and it would be high. We're like, what happened here? And I was shocked by that. What happens if someone is in that situation? What do you recommend?
Having a high blood pressure, it's one of the biggest risk factors for heart disease, amongst other factors. So if you do have high blood pressure, know your numbers, know where you need to be. Around 120/80 is where you need to be. And if your numbers are persistently high, make sure your primary care knows. And if you need to be referred over to a cardiologist or a kidney doctor to get that better controlled, I would highly recommend that.
Yeah, because our heart affects so many other things. And you were talking about know your numbers with your blood pressure, but there are other numbers that also seem to play a part, don't they? Like maybe blood glucose or something?
Yeah, so three main numbers that I tell all of my patients that they need to really know and be aware of is your blood pressure, #1, your diabetes. If you are a diabetic, knowing your hemoglobin A1C is important. And the third is your cholesterol. So knowing and really making sure that your bad cholesterol number is low is very important.
Is there ever a time that you see a patient and then after that you go to your office and go, shoot, this didn't have to happen? Can we
Yeah.
learn from that?
All the time, all the time. And, especially with women, it's important because like I said, our signs and symptoms are very subtle. And a lot of times we just chalk it up as, acid reflux or what have you. So knowing those symptoms, knowing your risk factors are very important.
So what's your
And
final, oh, I'm sorry, I didn't mean to interrupt you. I just wanted to know because I got 30 seconds left. What is your final message to women? You've got them right here, right now. What do you say to them?
all you women out there, make sure your heart health is in your hands. And today I just want to say, prevent it and know your risk factors. And if you do have those risk factors, go see your primary care doctor and take charge of it.
Absolutely. Amen. I did. I got on blood pressure medicine and now my numbers are perfect. perfect, and I'm so happy I did it. Dr. Garima Honda, thank you so much for joining us today. Really appreciate it.
Thank you.
And if you are looking to learn more about heart disease or the campaign, wearredday.com is an easy place to go. And remember, you might want to make an appointment with your doctor. Great day. We'll be right back.